My name is Yandron Kalzang. I'm one of the Tibetan doctors in the US. I'm located in San Francisco Bay Area. And it is my great pleasure to host and organize this wonderful talks focusing on introducing Tibetan medicine to young generations. So today is July 11th, Saturday. I am so happy to be here to work with this wonderful woman, one student, one still used to be a student. So it's my pleasure to introduce them. And one of the things this is organized by ATMA. ATMA is a organization, nonprofit organization focused on preservation, protection, and also practice of Tibetan medicine. It's located in the East Coast. So we have a group of people and a lot of, we're looking forward more working with more students also. So this is my brief introduction. Maybe I say a few words in Tibetan in case there are some Tibetan students. Just the Nyaming Le Akesang Gusi Tenzin Palki some to share ni today to the American Suri Hampone to Cheje and I to Shunosolia Penang to Chia the which is somebody and Dina Lolia taking on to member town and the local issue. So the first one is one of the speaker is Dr. Tawni Tidwell, and one of our student here is Tenzin Palki. And so I'm here for two roles. One of them as a ATMA's board member and also as one of the speakers. Same thing as Tawni as a speakers, and also she will be sharing wonderful her stories, but also a board member of ATMA. So I'd like to invite Tawni to give a few words. Welcome words. Thank you.
Wonderful. Thank you so much, Yandron. So my name is Tawni Tidwell. I'm a Tibetan medical doctor as well as a biocultural anthropologist. And I'm also a board member, and I'm just really delighted to be here with you all today. And thank you so much to Yandron and Kalzang for organizing this, and Atma for bringing this together, and for Tenzin Palki for managing, organizing, and recruiting this fantastic group that's joining us here today. And really the opportunity to speak with those who are interested in Tibetan medicine from the Tibetan youth community. So those who are in high school, in college, in graduate school, and beyond, who are interested in Tibetan medicine, are interested in medical careers that also relate to Tibetan culture and Tibetan medicine writ large. I'm just really looking forward to being able to share a little bit of our story, both Yandron and Kalzang and my own story, about how we came to study Tibetan medicine and how that might synergize with things that you're thinking about in your own path, futures, and any questions that you might have. So, any that pugin on the giving that Tawni Tidwell indigen on the Tawni Tidwell segi the pugin on the Rangchun Lamo Tedin Somo tis ring chara in the data Rangchun Lamo Tedin Somo yin. Any ngi tandaran di Madison, Wisconsin la degi nga shinjupa chiyin any mirik rikpa namya the gengu rikpa mirik rikpa di biological anthropology ki shinjupa yin any pibi member yin any kiranza samala tashle samji shugi ni tijina any Tenzin Palki.
Hello everyone, good morning or good afternoon, wherever you're tuning in from. My name is Tenzin Palki, and I will be a rising fourth-year student at the University of Texas in Austin. And I was kindly offered by Dr. Kalzang to shadow in her clinic over this past winter break in 2019, in January of 2020. So I was really able to see how she, integrates working with a non-Tibetan population and spreading awareness about Tibetan medicine in her clinic. And it's drawn me into the practice, and I'm very interested in studying more about Tibetan medicine for my undergraduate thesis topic, and kind of seeing and collecting data on barriers that could be keeping Tibetan medicine from being more widespread. So I'm really looking forward to hearing Dr. Tawni Tidwell and Dr. Kalzang's journey of what got them to where they are today. So without further ado, I would love to pass it back to Dr. Tawni to give us a little bit about her journey.
Great, thank you so much, Tenzin Palki. So today, in about 15 to 20 minutes, I just wanted to share a little bit about my own journey coming into Tibetan medicine. And some of this, I'm going to bring up some questions. And when we have discussions, hopefully, if can we, Tenzin Palki, can they just chat in to offer questions, or how is best to bring in questions to the group?
If they can or if they have like a microphone they can speak into, they could unmute themselves, or they can also type the questions as well, I think.
They won't be able to join in with us in a Zoom, so they will be typing in. We can recommend them to.
Okay.
Are they able to chat with us? Or they can send a message to Facebook. So Eric might be able to take a look at it. Yeah.
Great.
Also, I forgot to introduce our tech person, Eric, always is behind us. Sorry, I missed you there, but thank you so much for your time. And I know you have a baby to take care of, but thank you for taking care of us.
My pleasure.
Great, wonderful. So some of the questions that I would like to just kind of explore today with you all is, one, why did I study, or why did I decide to study Tibetan medicine? And then what kind of a background maybe you should mute.
Oh, okay, sorry.
Great. Can we mute? Okay, great, wonderful. What kind of background is useful to study Tibetan medicine, or what did I find most useful in my own background? What was it like studying? So I studied both at Mensikang in India, as well as Sorik Loling in Amdo, and some of the language difficulties in transitioning from a Lhasa-based dialect to an Amdo-based dialect. Do you need to be a Buddhist to study Tibetan medicine? What is it like to return to the US and begin practicing in a Western context, in a North American context? What research has been important to Tibetan medicine? And what research, I'd like to talk a little bit about the research I've been personally involved in that I found exciting and very inspiring, and some ideas about future possibilities. So I grew up in South Korea when I was 2 to 5 years old. My dad was an army doctor, an orthopedic surgeon. And I think from a very young age, I had this idea that different cultures, different perspectives on the body might have new insights on the body. So from a young age, I was really interested in medicine, and more interested also in different ways of looking at the body. So I'm from Colorado. I grew up, when we came back from Korea, we moved back to Colorado, and I was in a environment that very much looked at outdoor culture, climbing, high altitude, these sorts of things. And I was very interested in these kind of activities. I was really interested in how does the body change when you're put in high altitude environments? How does the body adapt to extreme environments? And so I wanted to be an astronaut as a kid and all the way into college, and was interested in how does a spaceless environment change the way that we understand what our body needs? How does our current environmental context on this earth allow us to have certain ways of cultivating health, cultivating well-being? And how does taking the body in a totally different environment change that? So when I went into Stanford for my undergraduate years, I was a physics student. I love physics. I grew up fascinated by astronomy and science, of particularly how does our understanding of the universe, how does our understanding of reality help us to understand our experiences as human beings beings in this world. And so I wanted to be an astrophysics astronaut and look at aerospace medicine as a way to look at the body, but then take that into my career trajectory was to then work for an organization like Doctors Without Borders, look at extreme conditions in terms of environmentally, poverty, nutrition deficiencies. So I was really interested in the body's different experiences. And my freshman year at Stanford, I met a Tibetan who was working at Stanford Medical School, and his father was an Amchi, a Tibetan doctor, and he started telling me a little bit about Tibetan medicine. And my mind was really blown. He was talking about Tibetan culture, a population on the rooftop of the world, very unique environmentally, very unique. At that point, we knew a little bit already genetically. And Buddhism being a central foundation for this medical system, understanding how the mind influences the body and how vice versa, how the body can influence the mind. So this deep understanding of these interconnections. And in those conversations, I realized that I wanted to take some of my undergraduate years to explore that. I thought that I wanted to do pre-med with Western medicine, with Chinese medicine. And so instead, I shifted to studying Tibetan language as a freshman. And I learned about a new program that Emory University had started over in India, in Dharamsala, with the Institute of Buddhist Dialectics, which is His Holiness the Dalai Lama's main institute of Buddhist learning for both monastics and secular students. So it was a collaboration. It was the first year ever. And so it was a group of, I think we had 10 of us that were able to go over, learn Tibetan language, Tibetan culture with some of His Holiness's top geshes. The head of Sara Higher Tibetan Studies College was our language instructor. It was really amazing opportunity and full semester program. And in that, we were given an opportunity to take 1 month for research. And I thought, well, I'm going to start learning a little bit about Tibetan medicine. And as I started speaking with Amchi during the program, I realized that this knowledge system is much vaster than I could imagine. And the kind of questions that I wanted to ask were questions about how do you read the body through pulse diagnosis and tongue analysis? How do you understand changes in the body and progressions of disease through tracking these kind of perceptual means? How does these complicated medicines that have up to 100 different ingredients, how allow me to explore? So I decided instead to start looking at different perspectives within the Tibetan community about what they envision in Tibet, some changes they envision in Tibet in the future. And when I came back from India, I went up to Ladakh for the summer, lived up in Ladakh for several months, and with a family up near Lakir, which is at the time, not many foreigners had been in Lakir. So it was a remote village, way up at 12,000, 13,000 feet. And so living really, really traditionally. So learning how to shepherd animals, milk zomos, all these things. And I realized that a lot of my life skills also, I didn't know a lot about just kind of this living in different environments. So I came back to Stanford, and in pursuing my pre-med and physics degree, started really looking into my own heritage. And so my own heritage, we have Native American background. On my father's side, we have Cherokee, and on my mom's side, we have Oglala Lakota. And my grandpa lived on the Assiniboine Reservation up in northern Montana. And I started asking a lot of questions about how did these medical systems, how do these different traditions understand health and healing? How did they understand our relationship to the natural world and our relationship to our bodies? And so in that experience, I started learning a lot about the medicinal plants of North America, of how knowledge was transmitted in these communities. And at the same time, I was keeping up my Tibetan language. So in my senior year, I went back to Tibet, and I was part of I went to Tibet. University of Virginia and Columbia, where foreign students would go and study language. And being in Tibet, being able to go to Lhasa Mensika and being able to explore, I mean, every weekend I was out traveling to every remote corner from Samye and Chimpu all the way to Chomolungma and Mount Everest, to all the monasteries across the central area down in Tolpoka. And I was really moved by how the landscape also really shaped understandings of health, understandings of this medical system, and that the medicinal plants, the minerals, the geology, that Tibetan physicians really are the naturalists of Tibetan society, learning to read weather, learning how to see changes, learning how to understand how to bring these aspects of the natural world together to create medicine, to purify toxins. A lot of the poisonous plants that we might not think as medicinal are integral parts of the Tibetan medical pharmacology. And so I was really blown away by also how this system had created a corpus of textual knowledge that was also transmitted rigorously through time. And so when I came back to Stanford, I decided that this is really what I want to work towards. Now, it took a long time between that kind of intention that was set and the actual ability to do that. So I graduated from Stanford in 2004. I ended up living in the woods for a year and a half with a wilderness survival school, learning how to survive on the land, learning also about medicinal plants in that way, and how to use them, how to make them into medicines, how to track animals. And I really see this period as important for me, also in the training later that came with Tibetan medicine, because it helped me to learn how to read the landscape, how to read changes in the body, how we're affected by weather systems, how we're affected by different nutrition capacities, how we're affected by different behaviors that actually come from a rich evolutionary heritage, right? That we are just in this modern era living in a very strange way. And Tibetan medicine really allows us to see this mismatch of our current way of living and a lot of the neuroses, the mental health illnesses, the chronic inflammatory conditions, right, that come from this dyssynchrony with our environment, with our habits, with our lifestyles, and with our minds. So this really kind of set a tone or a background for me. I ended up going down to South America, working for a program called Where There Be Dragons. I was an engineer in Lima and started working with communities in the Amazon, the Waripari and the Machagenga, and working with some of the curanderos in those communities to see how they also approached their medical traditions. And even though in these communities, they have thousands and thousands, tens of thousands of medicinal plants, one of the things that struck me working in this community is that they did not have a written form of this knowledge or a way to rigorously transmit this kind of knowledge. And so Don Alberto, who is one of the curanderos that we worked with in Pilcopata, he said, you know, my grandmother knew 5,000 medicinal plants. I know 2,000, and my niece, who I'll pass this tradition on to, will know maybe 200. And this heart-wrenching reality of realizing that this tradition that keeps this community healthy and well is being lost so quickly. And it really brought home to me how precious the Tibetan medical system is, that having a corpus of the Gyushi, the 4 medical tantras of this canon, first of all, and hundreds of commentaries, right? And this ability to rigorously transmit knowledge over time has retained this kind of knowledge for centuries, right? For over 1,000 years, to really propagate it whole across, right? There's been changes, there's regionalisms, there's different unique parts to different parts of Tibet and how it's come across time, but it really gave me this sense. So I ended up contacting one of my directors and saying, I want to go back to India and learn I want to pursue Tibetan medicine. And so at that time, Emory still had the program. So I went back as a teaching assistant, and I was a teaching assistant for Geshe-ma Kalzang, who was the first Geshe-ma, first female Geshe, German woman who was at the Institute of Buddhist Dialectics. And now we've had many female Geshes, and worked closely with her in the Buddhist philosophy course for the study abroad program. And through that was introduced to my teacher. And my teacher is Amdo Gyamtso. He was the vice principal of Mensikang. And I think he looked very suspicious at this white girl who was very eager to learn Tibetan medicine, and I think had some very real skepticism. And I say that because I now get exposed to many who say, oh, I want to study Tibetan medicine. I think there's a beauty in that enthusiasm, but maybe an inability also to see the rigor of it and the journey of it, that it is medical training. It's 6 years of medical school. There's the equivalence of anatomy and physiology, clinical chemistry. Tibetan physicians are pharmacologists as well as clinicians. And so I think in some ways I didn't have any idea of what I was getting into, and until I started kind of wetting my feet with it. So he started teaching me a little bit after every day in his office, an hour to 2 hours a day. And he said, eventually, if you really want to truly study Tibetan medicine, you're going to need to take the entrance exam and memorize the grammatical texts and enter informally as a medical student. And so I had told him my interest in having training in science to pursue a PhD concurrently with it. And he was very, very supportive. And so he asked about the possibilities of me combining those paths. And so that's when I started exploring the combination of a PhD in a science and then formal Tibetan medical training. So I had applied to several PhD programs, Harvard, Columbia, Emory, all over. And I thought that these international program or interdisciplinary programs were truly interdisciplinary. And what I found is that most interdisciplinary programs are really in the humanities or maybe in the sciences, but like kind of a little interdisciplinary. They're not truly interdisciplinary. And at the time, the Emory Tibet Science Initiative was also in Dharamsala. It's a program that is bringing science to the monasteries and led, it's His Holiness's vision, but Geshe Lobsang Tenzin Negi, who's really led that. And one of the professors who's been central to the neuroscience core of that was there in Dharamsala. And she met me in the kitchen and she said, well, why don't you think about anthropology? And I said, well, I thought anthropology is just culture and, humanities and all these things. And she said, no. If you look at biological anthropology, she's a neuroendocrinologist. And so she talked about looking at the study of humans across societies, across populations, across cultures, right? Understanding how they relate to their environment, to their culture, to their society, to their unique ecological circumstances. And I was like, oh, I didn't even know there was this area of study. And it's exactly the area of study that's done a lot of forefront work in high altitude medicine and biology, of understanding epigenetic differences across caste systems, across race. And so that was my entry. And she said, let's just move your application over to our department from the other department I applied to. And that was it. I went back to Peru and heard that I got into this program. I let Amchi Kenrap know. He was thrilled. And so he decided to take a sabbatical at that time and kind of come with me to my first year at Emory. And he saw it as a great way for him to work on his English because he's really passionate about research and working with scientists on research, and really His Holiness's vision also for Tibetan medicine to have that experience. And so my second semester, he arrived and I helped translate for him class teaching introducing Tibetan medicine to undergrads at Emory. At the meantime, working on memorizing the grammar text to get ready for the Mensikang entrance exam. Now, at this time, Mensikang in Dharamsala only allowed 2 student groups every 5 years to enter. And those student groups were only 20 to 25 students. So you had to time it exactly right, take the exam, enter in, and if you don't make it, you have to wait another 5 years. So I knew that the timing had to be exactly right. And I also knew that the entrance exam was 5 days long, 3 hours a day, where it tests you on the grammar text, on translation, on Buddhist logic, on general Tibetan culture knowledge, which maybe for many of you listening would be very easy, but for a white girl from the US, I was like, I don't know what, Vajrapani means symbolically, or I don't know what the Tashi Targyal means, or I don't know how many parliamentarians there are from Kham, in the Drutuk, the parliament. And so these were things that were on the exam, right? And so it took me a year to train, and luckily I had I had Amti Kenrup to help. I had Gense Bakrigzen, who was our Tibetan language instructor at Emory, and then Sanjit Tashi, who was from the Library of Tibetan Works and Archives, had just come to Emory to work as a translator, science translator, and they put me through Tibetan language boot camp. I mean, I thought I was pretty good, right? Like I traveled all over Kham, Amdo, Lhasa. I had been in the Tibetan community, a cumulative of 5 years at that point. I thought my Lhasa Git was pretty good. And I remember Sanjit Tashi telling me, Tawni, you've just put a toe in and now we're gonna push you in the water. And so he every week, it was an essay, it was, he would grill me on the grammar text. He would make sure that I knew how to actually answer certain questions, and pushing me to read widely across Tibetan literature, read widely across Tibetan culture, right? Kapta and Payu and Pugitubab, just really getting more of a familiarity. And the next year I sat for that entrance exam and I thought I failed miserably. It was one of the most stressful experiences I've had in my life. And I made it just across the 51% to pass. And I was the first Westerner to pass. One, because the test I think is really, really hard. And even for Tibetan students, right? And so they have one foreigner seat. And I had a friend, she was a Russian Armenian, and she had received His Holiness's support. So she didn't really speak much Tibetan at the time, but she got into Mensikang also for that. Sorry, I'm taking probably too much time. I'll kind of wrap up here. But she got in from His Holiness's support. And so we went through in our class, the batch 17 there. And so I'll just briefly kind of wrap up kind of my narrative so that if there's other questions as we can go along back to some of these parts. But I spent 2 years at Mensikang, and His Holiness, when I first was asking to study Tibetan medicine, I had an opportunity to have an audience with His Holiness and ask for his advice. And he grabbed my hand and said, I think you should go to Amdo. And he laughed. He's like, I'm from Amdo. And he just laughed and laughed and laughed. And then he said, no, honestly, there's really great scholars in Amdo. And if you have a chance, I would say go. And if not, you're more than welcome here. And so I had that in the back of my head. At the time when I first started at Mensikang, you had to pass the HSK, the Chinese language entrance exam, at a level 8, which would have taken me many years. They changed the policy years later, so you didn't need that. And I was able to transfer to Amdo. And so I did my last several years in Amdo. And a very different perspective. I'm happy to show, I have some images also of the different contexts. But I would say that one of the biggest differences in Amdo compared to at Mensikang, one is language. Amdo dialect is completely different. So it took me a good 6-7 months to even be able to adapt to this new dialect. But one is that we had a hospital of 1,000 inpatient beds and 1,000 outpatients a day to be doing our observations, residency, internships. So to see Tibetan medicine alive in such a way where tracking patient cases, so I would spend a lot of time in our gastroenterology, our Pogyutsanka, to see things from pancreatic cancer to IBS to gallbladder removal complications to, I mean, just you name it. And to see that it wasn't just medicine, that we were using external therapies, we were using tarka, a bloodletting, we were using everything from needle therapy to mebum to cupping therapy to massage to extensive medicinal bath therapies to moxibustion. I mean, it was just like the whole scope. And to be able to then also go across Amdo and to gather plants and then to see those medicines made on campus, that for the whole hospital, we make all the medicine there. The exposure and integration of that education gave me, so it just fired me up. It just made me, I think, made me realize the possibility of Tibetan medicine, the scope of it, to see it in like a mainstream form, to see outcomes, to be able to track outcomes of patients that are there for months, 2 months, 3 months, right? And to see the possibilities of that. And that's what really drove me coming back to the US and wanting to one, practice, to being passionate about being a clinician and having that impact with patients, two, being able to see the impact at such a scale that made me realize we need research that can showcase how amazing this medical system is, how different it sees the body, how differently it approaches pharmacology. I mean, we can talk about this later, but Sotel, in terms of our how do you purify mercury, bind it with sulfur to create a non-toxic form? Like that in and of itself has blown away chemists that we've worked with, right? How do you look at intractable forms of cancer to achieve certain outcomes that we can't achieve necessarily with Western medicine for some forms, right? How do you look at nutrition and lifestyle that can make radical changes by just looking at how different constitutions, how different people metabolize, right? That's also now cutting edge. Really, my coming back to the US is that I'm passionate about is really practicing, making an impact in patients' lives and working with scientists in Western medicine and Western research to create those bridges. And I really see that as the possibility of the future of Tibetan medicine, that we have the opportunity where Tibetan youth are getting phenomenal educations, right, on the Western side and the Tibetan side, and that we have the opportunity to create a new paradigm for Tibetan medicine. And it just makes me very, very exciting. So I'm sorry I took too much time, but if there's any other questions, I'd be happy to answer and look forward to turning it over to Yandron Katsala. Thank you.
Yes, we actually did have a question come in from Deji. She asked, what suggestions would you give to beginners who are very interested in Tibetan medicine to start learning about the practice?
So one of my questions, I guess, for Digibijin? Digibijin. So I would say first to start getting really familiar with the Gyushi would be really great. There are some texts in English, but I have to admit they're not a lot of really good resources in English. So I'd say Amchi Yeshi Dundun has published a couple of his life and some of his perspectives. But I would say getting familiar with the Gyushi, and then we can at the end give a list of readings that might be helpful in terms of research, introductory books, kind of different layers or levels, so that people want to get a little more.
Awesome. I think there's also a question from Tidwell Dolkar, and she asks, how could you remove mercury from our body with Tibetan medicine?
Should I answer that first, or Gayandana, do you want to go first and then we can come back to that question?
Yeah, I was thinking maybe we can hold on to the question,
Great.
then we answer. But also, just to answer DJ's question, maybe since we are going to have 3 sessions for this, so after second one, we will collect all the resources. We will collect a link, make a link. So for the last one, we make it as a more conversational, the September one. Then we can put all the link, so you will know even more. Yeah.
Awesome. So I guess I can hand it over to you, Dr. Kalzang, to share a bit about your journey.
Yeah, thank you. So I like to, how can I get my the slides? Can I do the slide, Eric? Eric?
Yeah, yes, you can.
Okay.
You can. I need to make you a host.
Okay, so I just go ahead to start, right? The slide. Okay.
You'll need to be able to share your screen.
Yeah, I will go to the screen. Control details screen. Okay, so now might be okay. Screen broadcast Zoom start. Okay, so 1 second. Okay, so can you see now? Can you see the screen?
Yes,
Slides are up.
Okay, good. Okay, so thank you so much for your extensive experience of journey to Tibetan medicine field and being a doctor as member. So I like to share a little bit about my own journey to Tibetan medicine as well. But I want to connect with the topics that you have mentioned from for the Tibetan medicine, from academic education to research to the clinic and commonly household usage. So I will focus some of those things. And first of all, I like to say a few words about how and why we like to start the conversation between the Western and Tibetan medicine for student introducing. So if you look at the screen, you will see the 2 totally different diagram of 2 medical systems. So on your left, you can tell it's genetic. It's a chromosome, which is the body building, the blocks of body building elements or substance. On the right side, this is a typical, maybe some of you have already seen this photo, but this is a connection with your mind and body. So a lot of things, it will be explained later, but Tibetan medicine will be focused on mind and body together and as the root cause of all conditions or elements or the problem based on these 3 animals. They all present different things. So you will discover more and more, but I like to put this, how we can bridge these 2 medical systems to explore your career. So one of the things, why there's a potential for Tibetan medicine, why Tibetan medicine can be helpful for modern days, especially I like to give you this introduction to the coronavirus time, why Tibetan medicine is useful, although not a lot of people know. And we started a different conversation webinars in the early April, and Tawni was one of our co-sponsors and also co-organizers with me together. So we had all different dialogue on multiple perspective of Tibetan medicine to coronavirus and integrative care and healing to coronavirus. But that's not necessarily mean treating coronavirus. There are a lot of coronavirus-like symptoms. So you can take a look at those. I can come back, but since I only using 10 minutes, I'm gonna go to the next part to share some of my journey later. So during the coronavirus time, because we all locked down, so what we used, how can we diagnose patients? Like Tawni mentioned, it's amazing to see the pulse diagnosis, but we have to be in 6 feet away. So what shall we do? We become paralyzed? No, the Tibetan medicine can be still helpful. There's many other ways to help. So one of the two ways that we are seeing patients through the screen, through this way, on the Zoom or social media, or not social media, the different online platform. So you can check the patient pulse, you can check the patient's tongue, you can check the urine, and all those things become our diagnostic method. So back to my story. So I put a garlic. So this is one of my story, how I drawn into garlic, got into Tibetan medicine. So when I was a child, the Tibetan Medical Institute was next to our school. So one of my uncle lives there, and we have a lot of classmates who goes to school, to my school, but also they are go home. So I like to go back to them because always I see a lot of garlics on the floor, and I didn't know why they're using garlic. And I was thinking, at my house we only eat 1 or 2 cloves of garlic. Why those people living in this community are eating so much garlic? But I did not know they're using for the herbs. So garlic has many multi functions. It's a wonderful herb, and you can use for a lot of people, especially people with insomnia and people with emaciated. But that does not mean garlic is good for everyone. It's good for some people, but it's not good for everyone. So for instance, if someone with a sinus congestion, runny nose, nasal congestion, garlic actually will not be helpful. Garlic will be one of the one of the things that we will take out of your dietary. So garlic, I have a really good connection, the deep connection to garlic. When I look back, garlic is the one drawing me back to seeing in the we call Menzikang in Tibet. So Tibetan Medicine and Astrology Institute. So their garlic is one of the examples that, but there are a lot of other herbs they are using. They wash, they dry them, they put under the sun. So as a child, I did not know why. So this is the one of the thing I want to show my best friend of garlic to you. Now I want to share my next story. I put this weird signs here. The reason is if you look at the 2 arrows, one of the arrow is going forward, the other one is making U-turn. So I came to US in 97. One of the goals to come to US is I wanted to study Western medicine, which is contrast with the Tawni. The reason is because growing up in Tibet, especially in my generation, in 80s, if you only know Tibetan medicine, you don't know any about Western medical science. They don't really treat you as a main doctor, as a or very knowledgeable doctor. So you have to know some Western medicine. Then I thought, oh, in order to study Western medicine, why would I study? I mean, we had some basic education there in Western for Western medicine, and those Western medicine we learned in Chinese because the Western medicine wasn't translated into Tibetan, but was translated into Chinese. So it was a very hard journey for me to learn the Western medicine in Chinese. Although I speak, read pretty well in Chinese, but in order to understand the medical term, it was very hard. So I was thinking, Western medicine came from West. Why would I study here? And I like to go to US to study some Western medicine. So I came into the US in 97 and with the goal of learning Western medicine, but I I wasn't speaking much English then. So in order for me to learn anything, I had to go to study English. So I was in English extensive international English schools at UC Berkeley. So when I was learning the English, and one of my classmates brought an article to me, said, Yandron, look, the acupuncture has become so popular in the West. Maybe your Tibetan medicine also will become really popular. So we started to reading the article, the insurance will be paying for acupuncture. There are a lot of people are spending lots of money going to China or going to school in the US, but at that time there was not many acupuncture schools, but they're much more than Tibetan schools even nowadays. So, so I thought, oh, in this case, I studied Tibetan medicine already in Tibet. Why would I go to study something completely new and forget about what I have? I'd rather stay on this because I always had a wonderful history of practicing Tibetan medicine when I was little, but also, but when I was also came to US, when I saw that big shift, so I said, no, I'm not going to study any other things. I like Western medicine. I love the surgery part. I love other parts of the Western medicine, but I'm not going to switch my my career. So I stayed on path of Tibetan medicine. So this is my U-turn. Sorry. Can you wait for 1 second? Okay, so I lost my slides. So sorry about that. My son was playing fluid. So okay, let me go back to the slide. Okay, so now back to the Tibetan medicine. And one of the things that we have mentioned, the Tibetan medicine and Western medicine has a very similarities, also differences. So this is one of the slides that another Tibetan doctor created. His name is Dashi Dorji in the past. So in Tibetan medicine, we work with the 5 elements, which are the building blocks of mind and body. And in Western medicine, we have all the chemicals or chemistry elements, which is here on your right side. So there's an equivalent of earth, water, fire, air, and space. And even today, like with the, we work with those 4 elements, earth, fire, water, earth, but space is something not being mentioned in Western medicine, but it's being practicing in Tibetan medicine very well. And it's one of our elements, very important elements, and which connect to our quantum particles. So one of the things about Tibetan medicine as his holistic and integrative medicine, because it works for your mind and body. It's not focused on the body only, mind and body are always connected. So at emotion or mental level, so remember you saw the 3 animals at the first presentation on slides. We have these 3 animals. They basically represent the negative emotions, especially emotion with ignore, we call mariba, is the 3 poison, which are the root cause of our mental health. And then there's a desire, hatred, and close-mindedness. So we call Decha, Xiedan, Timu. These 3 are the root cause of our mental health. But because of that, then it can cause physical health problems. So speaking of that, because I have always been interested in Western medicine, even if I did not change my profession to be Western medical doctor, but I always looking into the opportunity to integrate and work collaboratively with the Western medicine. So I'm one of the doctor and director at the Kunde Institute. So what we have been doing is we have been developing the Tibetan medicine at Stanford, not as an educational like academic class, but as a one of the site of student, medical student to observe the Tibetan medicine, how we practice. So they send a medical student to our clinic. So they come to visit, they shadow us, then they will write a feedback. After that, we also been hosting symposiums for the last 6 or 7 years, even longer before. So we had those preliminary times of introduction to Tibetan medicine at Stanford. Then we had introduction to Tibetan medicine and bridging Eastern and Western medicine, focusing on how to make referrals to each other. And third one is integrative medicine approaches, setting roles model with the Tibetan and Western medicine. Number 4 is pain management in Tibetan medical perspectives. And number 5 is individualized and personalized care. Then the number 5 is the last one is we actually going to have a mental health this year, but did not work because of pandemic. So I want to stop here. Maybe I'm taking too much time. I will close up with the last two slides later. How's the time doing? Yeah, I think I need to stop here.
Yes, so we have about 7 minutes left in the webinar, and we just had the one question from before about how we can remove mercury from the body, and that was from Tenzin Palki. So either Dr. Tawni or Dr. Gesang-La can take that.
So Tawni, how about you take that, because I have a few other things to mention later.
Okay, great, wonderful. Could we get back the regular screen?
Yeah.
Great. And then I'm wondering if I can do a screen share. Do I have? Okay, I do. Great, wonderful. So first of all, for Tenzin Palki, so from a Tibet medical perspective, I think there's 2 aspects to this question. One is how we remove it from a Tibet medical perspective, and that's really looking at to what degree is there mercury toxicity for that individual, right? So there's different medicines that will bring online for that person, as well as dietary recommendations and lifestyle shifts that will look at, actually, it's almost like a chelation. It's actually a metal detox. And this will often be using various precious pills as well. Now, it might sound counterintuitive to use a precious pill that it itself has metals to try and detox an individual from metal poisoning, especially mercury poisoning. But I think part of what I want to also show and do a screen share is some of the research that we've been doing on tsotel. So tsotel, or nguchu tsoruchemo, is a very, very special compound in Tibetan medicine that binds mercury to sulfur, as well as many other metals, minerals, and organics. And so we've been very fortunate at Emory University to have access to fantastic chemist collaborators to look at this molecule. My colleague, Jim Nettles, who's a pharmacologist who's worked for Novartis for many years, one of our top pharmaceutical companies, who's worked in antivirals. He's been a very important part of this research and the research design. David Lin, whose specialty is looking at the molecules of life. How do molecules become living beings? So he was just excited about this molecule because he realized that it's a nanoparticle, and it's what's called a MOF, a metallo-organic framework. And so I'm going to screen share right now to show you a little about what I'm talking about this chemical, or this compound that Tibetan medicine developed hundreds of years ago, right? And still uses as an essential ingredient to most of our precious pills, which is also about how the body then learns to, through the use of this catalyst, basically to help the body to leach metals, to bind and then remove from the body these heavy toxin metals. And the reality is we don't know how it works in the body from a Western perspective, because we don't know if it crosses the blood-brain barrier. We don't know exactly how it actually removes, but from a Tibetan medical perspective, we know that it creates an affinity with these toxins and then helps leach it. And so this is part of what we're doing in terms of research, is understanding what is the molecule itself, doing a compositional chemistry analysis, moving that into cell toxicity studies, and then moving that into understanding the mechanics of it. So I'm going to show you just real briefly what this looks like. So I'm going to start a screen share. So this comes from a presentation that I gave at Emory looking at ways of knowing. So how do you establish valid evidence clinically and pharmacologically? So I was looking at biomarkers, particularly related to cancer for the clinical side. And what I'm going to do is just scroll down to the pharmacological side to help you see what this molecule looks like. And so this molecule is basically, you can think of it as a mercury atom that is hypersaturated with sulfur atoms. And so what you see is that the available electrons for bonding, right, are saturated by these sulfur bonds, so that it doesn't have any, there's not a reactive species, right, from which it can actually create free radicals in the body, wreak havoc in terms of the cells and tissues. And so what we see when we looked at the human data, right, so this was led by Dr. Sarah Salin at Hadassah Medical Center and the clinical research department at Mensikang for the human studies part, and Dr. Tenzin Palki, who I think will be speaking next week, is what they looked at is that when people ingest, right, in the form of precious pills, this molecule, tsotel, then we see that people have large amounts coming out in the urine, and they have no mercury toxicity signs cognitively, which is very, very counter to what one would assume, right? Dr. Sarah Salin actually went into this collaboration with Mensikang thinking that she would, whoa, and lo and behold, find all these mercury systems. She thought that these people, Tibetan normal patients who are taking 7 times the recommended dose of mercury from the FDA, right? They had increased cognitive scores. And they had leached large amounts in the urine, but they were actually not finding any mercury toxicity symptoms in neurologically, in terms of muscle activities and functions, in terms of cognitive reports and measures. And so this has been a really important research area that we've had the opportunity to begin developing into, because it shows that there is a sophisticated knowledge about how metals function and how we create detoxified forms of these metals. And what we now know is that in marsh systems, in natural environments, that the marshes themselves actually sequester mercury by binding it to sulfur in a very, very similar process. So Tibetan medicine has used this ecological model through its own theory to understand how do you, quote, detoxify something by binding it to another form, right? And so these molecules that we then have, so here's cinnabar, this is the red one, and it's a mercury sulfur in an alpha phase. And when we process, it's a very extensive 40-day process with many, many amshi that goes through this, ritually combining it with other metals, acids, and organics, it becomes then this, what we call tsotel, right? And it's a beta phase. And so what you see is that actually you enter a phase, it morphs into a different form through a temperature gradient, right? It's a very sensitive temperature point, and that's really where we then get the tsotel. So I know we don't have much time. I just wanted to share that briefly to say that it's through this pharmacological understanding of how metals, minerals, and organics function that Tibetan medicine uses the body's capacity also to then leach metals, to detoxify, for virals, for example, like Yandron Kalzang was talking about our COVID research. What does Tibetan medicine do for, say, a viral infection? Well, looking at that, actually, it's helping to activate the immune system, right? Helping to have it recognize what are the viral components when we're looking at a cytokine storm in which the whole vasculature, right, is reacting through inflammatory response. How does it help teach the body, modulate that response to help the body clear that virus, to clear that viral load? So these are just different perspectives on how Tibetan medicine functions in the body. So, right, that didn't exactly answer the question, but we can talk about that offline too, in terms of metal detoxification regimes in Tibetan medicine and any other questions. So I'll turn it over to Yandron Kalzang now.
Yes, thank you so much for that response. I think it was very insightful, and I wouldn't have even imagined that something like that would be possible.
Yeah,
It's very exciting.
Wonderful.
So,
Thank you very much.
Dr. Kalsama, I'll pass it over to you to say some closing words.
Okay. Yeah, thank you. So thank you very much for everyone's tuning and a wonderful moderation. You did a wonderful moderating job, and also Tawni did such a wonderful. Is it Rocky girl, American girl, grow up in Rocky Mountains, journey to the Himalayas, back to the which part? But Wisconsin. So wonderful, but I do want to go back to the slides. Eric, if you can help me to go back there just 2 minutes, I have few words to share there. Okay, so thank you. Okay, so we're running few minutes late, but I'll make sure to conclude really fast. Okay, so if people are interested in the slides, if you need the information, my part, I'm happy to share. And if you can send us an email at American Tibetan Medical Association, I put the email address atmainfo108@gmail.com, so you can take a screenshot of those. And another wonderful, great news is we have a volunteer opportunity for students, high school, college, or university, during the ATMA, for the ATMA during the summer of 2020. So hours and recommendation letters are up to request. So I have a few lists. You can take a picture of what we need, some itemized what we need. So you can take a screenshot, you can contact ATMA. And one good news is this is not the end. This was just the starting point of introducing Tibetan medicine to our youth. And next topic will be, next speaker will be Dr. Punso Wangmo. and Dr. Tenzin Amdo. It will be second week of August. I think I checked August 8th. Please check in our website and Facebook link. And so I like to close up. Thank you very much for your listening, participating, and thank you for sharing all the information with us. Thank you. Have a wonderful Saturday.